lot of parents in OP having a lot of queries regarding baby care.
Yeah.
Because there are a lot of traditions which being followed, the do's and don'ts. So
Correct.
parents are usually confused.
Yeah.
So it would be of great help to new parents if you could help them know the do's and don'ts.
Absolutely. No, I agree. Like there are so many of these queries when we sit into the OPD, we get parents who come with a lot of questions about it. So it's a very common question, but also very important question. To make things understand easier for parents, especially the first time parents, what we'll do is we can split this into the must do things as well as must not do things. So what are the must do things? One of the must do important thing is temperature regulation. As we are all aware, like babies are nursed in a very warm, cozy environment when they are into mother's womb. When they come out, they are exposed to a lot of temperature instability. Especially they tend to lose a lot of heat because they have larger body surface area. Now it is important for us to ensure that they maintain a normal temperature. And when I say normal temperature, it is important to have a normal environmental temperature. So many parents come and ask that what temperature should be maintained at home, like can we use ACs, can we use fans? So I always tell them like it is important to ensure that you maintain a temperature around 26 to 28 degree room temperature. If you're using ACs, you can keep it at same temperature, or you can use fans which is not like very high speed, like you can use it at the lower speed limit. If you want, you can swaddle the baby as per the external environment. Do not over wrap the baby or neither under wrap. So that's an important aspect. Temperature regulation is an important aspect. Then coming to the next must do thing, I would say it is ensuring basic hygiene practices. Especially I'm sure like in the current COVID era, all of us have got so used to more aware about. Yeah. So when I say that, like the reason why it should be more emphasized while handling a newborn is, as you know, like whenever there's a newborn in a family, there's so many people who are excited to take care of the baby, they want to handle the baby, they want to cuddle the baby. So it's important that whenever you touch a baby, you do all the basic hand washing steps. And whenever needed, use a hand sanitizer as and when needed. Also, if anyone at family, at home, they're having cough cold, it is important to maintain those distances. Even if mother is having it, she can nurse the baby, she can breastfeed the baby also, but it is important that she wears a mask. So these are like another important things.
We are glad that you answered that, because many parents have this question that if a mother is not well, she shouldn't feed the baby.
Yeah. No, if she can take all these basic precautions, it's I think so there is no reason why a mother and baby should be separated, isn't it?
Absolutely.
Yeah. And then coming to the third important thing is about establishing breastfeeding and then continuing that demand feeding as well as exclusive breastfeeding. Again, like as you know, like whenever a baby is born, it is important to establish breastfeeding, especially in the first 1 hour of life. So even that single drop of mother's milk, which is known as colostrum, is so energy rich. It is so important to the baby. It is also known as the first vaccine to the baby. So it's important to ensure that the baby receives it as early as possible. So it is important to establish breastfeeding. Now, establishing breastfeeding sometimes can be challenging, especially for mothers who are like first-time mothers, primary mothers. But it is if we support them during this period, they can definitely achieve that. It takes usually 48 hours for a mother to establish breastfeeding. During this first 48 hours, it is a learning process for the baby as well as mother, isn't it? So they will be more comfortable after the first 48 hours. And once that is done, let's continue that demand feeding. Demand feeding is like whenever the baby is hungry, you need to see if there is any other reason and try to breastfeed the baby. And once that sets in, to continue exclusive breastfeeding till 6 months of age. That's important. Now coming to the next must-do thing would be regular pediatrician visits. So those things will be there. Also ensuring that you expose the baby to sunlight. There's a lot of questions which people come and ask about whether to expose to sunlight and all.
Does it help in reducing the jaundice levels?
Correct.
That's a question which
So ideally, that's a question of debate. Like there's so many, we can discuss at length about it, but I would say it's not going to cause any harm. Yes, it might not reduce the jaundice level to that extent which otherwise the phototherapy would do, but yes, it is good to expose the baby to sunlight, not when it is very harsh, not when it is very cold in the morning. So ideal 20 minutes of exposure should be good. More than the do's, let's come to the don'ts.
Yeah, because there are a lot of traditional practices which are being followed, like application of kajal, putting oil into the nose and ears, giving them honey, and we've seen children suffering a lot also because of these things.
Absolutely.
So, you being the expert, probably you'll be able to help the parents more in detail regarding these things.
Yeah, no, it's such an important thing. Like many times, more than the do's, when we tell them not to do few things, they remember those things better.
Yeah.
So let's say like the first important thing is, like as discussed before, is about exclusive breastfeeding. See, babies don't need anything else. Mother's milk is the best milk which they can have. It is important to continue till 6 months of age. So as far as possible, try to continue breastfeeding. If due to some circumstances, like some medical concerns in mothers or like some contraindications, if mother milk is not there, then you use formula feed. But please don't go for cow milk, buffalo milk, packet milk. I'm sure you would.
Yeah, because even in this era, people do give cow milk, buffalo milk, especially in rural places when mother's feed is insufficient. So please do not give that. It leads to vomiting, diarrhea, and a lot of other issues in babies. So exclusive breastfeeding, and if feeding is not sufficient, then the closest to mother's feed is formula feed.
Yeah, and always consult a pediatrician. Try to find out what exactly is the reason why mother is not getting milk, and then we can look into those things. Then comes the other important thing is not putting any oil or in ears, not putting oil in nose. That's a traditional practices which doesn't help at all. Not giving honey or even janam guti. Like I come across a lot of patients who, like, even when the baby is just born, the first thing is like they don't even look for the mother. They are trying to get honey. Even in like metro cities we see this kind of problem. So it's important to make them aware that it is in fact going to cause more harm to the baby. So trying to avoid those things are more important.
Yeah, because honey leads to a serious problem called botulism, and so this can be prevented by avoiding all these extra things which you put in a baby's mouth.
Extending from there, like they also ask about water, like whether we should give, it's very sunny, it's very hot outside, shall we start water? So again, mother's feed is sufficient enough to ensure that their thirst is being replenished. So there is no need of water, also excess water. They also ask about, like, many of them are like more, they want to know whether when can we start bathing the child. So that's another.
The first bath.
The first bath and all. See, what we usually recommend is, it is better that let the cord fall and then you can start bathing, because during that time you can obviously do sponging and all those things, but if the cord is not completely dried and if it falls early, it can sometimes ooze. And it can ooze from there, parents get panicked, then it can lead to infections. So it's better to let the cord dry completely, fall naturally, and then you can start bathing. Babies don't get dirty because they don't go outside.
Yeah, and cords usually followed by 7 to 10 days.
Absolutely.
So it doesn't take longer than 2 weeks for you to get the first bath. So you can wait till the cord falls off.
Yeah, so that's another thing. Then when we go ahead and see, like, what are other important don'ts and all. See, it's important not to swaddle babies very tight. Okay, they are used to having flexion in their arms. They are used to having flexion into their knees and those things. That's how they are like into mother's womb. That's in fact a feeling of contentment. Many parents try to put very tight wraps and try to put very tight swaddles. That is not needed for the baby. Yes, it can help sometimes in handling the baby, but it has not shown any other evidence or any benefit other than that. Other things which also matter, or like we say don'ts, is do not shake the baby too much. Do not vigorously like massage the baby. Do not shake the baby, because that can itself lead to other complications in the baby.
Yeah, so the massage should be very gentle. It should be a pleasurable activity for the baby, so not too much of head pressing and pressing different parts of the body very hard where a baby is crying. So that should be avoided, right?
Correct. And other things are like, obviously, do not neglect fever in a baby, especially babies who are born like early, or like especially in the first month of life. That can be an indication of a very serious underlying problem. So whenever your child is like having high grade temperature, you should recheck the temperature after removing the swaddle. And if it is still high, it is better to consult your pediatrician after that. And it's better not to self-medicate. That's
absolutely, because in India, we have over-the-counter medications, and
Absolutely.
it's easy by word of mouth or discussing with other parents. They just go and buy over-the-top medications.
There's so many experts at home, isn't
Yes.
it? So it's good to
Yeah.
have like people who can give you advices, but it is always better to discuss with your pediatrician and see how it is going ahead.